It's Casey Jones. This is going to be a PowerPoint presentation on autism and gut health. I do apologize in advance for my eye. I have a sty on it. I was going to try to wait and do this presentation, but they don't go away very quickly. Okay. Autism is a spectrum disorder. No case is exactly the same. The most common symptoms are speech delays, difficulty communicating, and repetitive behaviors. Treatments usually start with ABA therapy and speech therapy. There are usually a lower abundance of the bacteroids, E. coli, and Enterococcus. There are usually higher abundances of lactobacillus and Clostridium. The gut-brain axis is basically a communication network between the brain and the GI tract, and it influences both the mental and the physical health. Dysbiosis is one of the causes of the behavioral and GI symptoms usually found in autism. Dysbiosis is an imbalance in the composition and function of the microbiome in our gut. Short chain fatty acids produced by the gut microbiota usually have widespread effects throughout the body. The most common ones are acetate, propionate, and butyrate. Potential trigger foods to avoid in individuals with autism. Not all of them, but for some cases, would be dairy products, foods with artificial additives, like artificial dyes or artificial flavors, MSG, and foods that are high in sugar. Prebiotics and probiotics usually help to avoid the natural balance within the gut. Or not avoid, restore, my bad. Studies show that individuals with autism are usually vitamin A deficient, so vitamin A supplements would help with that. Antibiotics aren't typically used with autism, but they can be used to increase stomach activity in individuals with issues like delayed gastroparesis, which can sometimes happen. And that could sometimes be causing the tantrums, or like if they're having issues like they're just throwing up a lot of vomiting, and just be because their stomach is holding onto that food and not emptying very well. Fecal microbiota transplantation is a procedure that is usually used to treat an imbalanced gut microbiome, which is dysbiosis, and it takes healthy gut bacteria from a donor, and it's used for a patient that has an imbalanced gut microbiome. And this is it. These are my sources, and thank you very much.